Peace, love, blessings, everyone. It's your host, Zia Begum, back at it again with another episode. Today, we're diving deep into a critical issue, Black maternal mortality. Now, I'm going to do my best to explain everything in simple terms for everyone to understand. I'm passionate about health disparities, and so I may get a little geeked out. Despite advances in healthcare, Black women in the United States continue to face disproportionately high rates of pregnancy related mortality and morbidity. This crisis is not just a medical issue, but a public health emergency that demands our attention and action. Black women are 3 times more likely to die from pregnancy complications than their white counterparts. In 2021, the maternal mortality rate for non-Hispanic Black women was 69.9 deaths per 100,000 live births, compared to just 23.8 for white women. These numbers, as reported by the Centers for Disease Control and Prevention, are staggering and tell a story of systematic inequity within our healthcare system. And mind you, 80% of these complications are preventable. But why is this happening? And what can we do about it? We're going to break this down in simple terms, looking at the role of implicit bias, socio-economic factors, and healthcare access in Black maternal health. Let's start by defining some key terms. Maternal health is a woman's health during pregnancy, childbirth, and the postpartum period, according to the World Health Organization. Maternal mortality refers to deaths related to pregnancy or childbirth. Now, despite the healthcare advancements, the maternal mortality rate in the U.S. has been steadily increasing. In fact, Black women are facing an uphill battle. Why? Several factors are at play. Socioeconomic status, healthcare access, and implicit bias in the healthcare system all contribute to these disparities. Implicit bias is when people make unconscious judgments about others based on their race, gender, or other characteristics. In healthcare, this means that Black women may not be taken seriously when they express pain or concerns about their health. One glaring example of this is the story of tennis champion Serena Williams. After giving birth to her daughter via emergency C-section, she felt symptoms that suggested a pulmonary embolism, which is a life-threatening condition. And for anyone who doesn't know what a pulmonary embolism is, it's blood clots in your lungs. Despite her concerns, the nurse dismissed her symptoms as a side effect of the pain medication. It wasn't until Williams insisted on a CT scan that doctors discovered, indeed, she had blood clots in her lungs. This isn't just about one doctor's failure to listen. It's a part of a broader pattern where Black women's pain is often ignored or dismissed by healthcare professionals. The causes of Black maternal mortality go beyond individual biases. Structural racism plays a huge role. For instance, again, socioeconomic status is a major determinant of health. Research shows that Black women living in impoverished neighborhoods are 120% more likely to experience maternal mortality than those in more affluent areas. This is linked to factors like access to quality healthcare and education. But also get this, and it may sound a little bit confusing, but try to understand. Black women with college degrees are still more likely to die from pregnancy-related complication than white women without a high school diploma. Education doesn't protect us. Status doesn't protect us. Again, Look at Serena Williams and the treatment she had received. For many Black women, particularly those in rural access to prenatal care, can be limited due to lack of insurance or gaps in healthcare coverage. This insurance gap disproportionately affects Black communities, leaving expecting mothers without the care they need to stay healthy throughout their pregnancy. To address this, Congresswomen Alma Adams and Lauren Underwood reintroduced the Black Maternal Mombist Act in 2023. This act aims to tackle the root causes of Black maternal mortality and improve access to quality health care for Black women. It's an important step toward making sure that Black mothers receive the care and attention they deserve. Implicit bias, unfortunately, doesn't just affect pain management. It also influences how Black women are treated in healthcare settings more broadly. Studies have shown that many healthcare professionals believe that Black women have a higher pain tolerance than white people. This is a dangerous stereotype has led Black women being undertreated or misdiagnosed. This isn't just a matter of poor care. It's a matter of life and death. Black women are not invincible and their pain is real. The medical community must acknowledge this and act with empathy and respect, rather than assuming that Black women can handle it without proper intervention. This isn't just about healthcare, it's about human dignity. Black women deserve the same level of care, attention, and respect as anyone. The statistics speak for themselves. Black women are dying in childbirth at alarming rates, and it's time we change. So what needs to change? Well, number one, healthcare access. We need to make sure all Black women have access to quality healthcare, including prenatal care, no matter where they live or their financial situation. Number two, bias training. Healthcare professionals need to undergo those through bias training to ensure that Black women's concerns are taken seriously and that they receive proper care they deserve. Number three, policy change. Policies like the Black Maternal Mombist Act are steps in the right direction. We need to keep pushing for laws that protect and prioritize Black maternal health. Number four, community support. Communities need to come together to support Black women, particularly those in low income and rural areas, to ensure they have access to resources and care. We have covered a lot in today's episode, but the reality is that the issue of Black maternal mortality is far from solved. We need to keep talking about it, keep raising awareness, and keep pushing for change. Every Black woman deserves to have a safe and healthy pregnancy. Let's continue the fight for equality and justice in healthcare. Thank you for listening to this important conversation. If you are moved by today's episode, please share it with someone who needs to hear it. Until next time, take care and stay informed. It's your girl, Zia the Begum, in the mic. Zia the Begum, here to stay. In her softness, she paves the way.